Good evening. Welcome to Left, Right and Centre. I'm Vishnu Shobh. On the show tonight, with surging COVID numbers and a spiralling death toll, India is now in deep trouble as far as COVID is concerned. But today, there is fresh hope. The vaccination drive has been opened up to 45-year-old citizens and those who are older. You don't need to have a comorbidity. If you're 45 and above, get the jab. That's absolutely crucial, as hospital availability has again been seriously dented. It is crucial also, and we keep saying this, for citizens to mask up. Also on the show tonight, a surprise and an utterly unexpected move by the Finance Ministry last night, a decision to fairly drastically cut the interest rate for key saving schemes. The move would have been disastrous for millions who depend on these schemes as a source of income. But by the morning, a massive U-turn. The government withdrew its decision to cut rates. The opposition asks why. Did the government suddenly remember that elections were on? All right, but let's just bring you a couple of images first of a number of celebrities, leaders and all getting their vaccinations today. So let's give you a couple of those images. Vaccinations open for 45-plus-year-olds. The Andhra Pradesh Chief Minister, the Railway Minister Piyush Goyal, among others, have got jabs. Politicians have appealed to get vaccinated. Jyotiraditya Scindia on this program, the author Chetan Bhagat will also join us later on. But first, what's the response been at the hospitals? I'm joined by Dr. Naresh Trehan, Dr. Sangeeta Reddy. I'm also joined by Dr. Rahul Pandit, member of the Maharashtra COVID Task Force. Dr. Pandit, let me come to you first. Maharashtra, obviously, a very specific concern given the spiraling numbers. What sort of reception was there today from citizens to get their jab?
I think the response has been fairly good and encouraging. A lot of people actually started queuing up right in the morning, and we could actually see the hospital administration and the hospital administrators trying to maintain the COVID appropriate behavior, the safe distancing until the close of the vaccination, which was, I think, way past 5 o'clock today. So I think we had a very, very busy day in the vaccination center. Of course, I was in the ICU. This is what I've heard from people, but that's what basically has been. It's been actually a very busy day in the vaccination.
Do you have a rough idea of numbers? Anything that you can share with us?
No, unfortunately, I don't. But on an average day, my hospital was giving somewhere between 600 to 800 vaccines. I'm sure it has been more than that.
And so how have you dealt with that, Dr. Pandit, the increasing numbers? More shifts, or you've spaced it out? How is it working for you?
So it's going to be more shifts. It's going to be probably now going to be extended up to 9 o'clock in the evening. The hospital admin is actually working at increasing the manpower. And that would mean that we would have a morning shift and an evening shift to space it out. Obviously, have more people, more booths inserted so that we can actually have many people getting vaccinated at the same time. So those kind of innovative things have been done. I mean, not innovative really, but some practical things to sort of accommodate as many people as we can.
All right. Well, Dr. Pandit is also Director of Critical Care at Fortis Hospitals, Mumbai. Let me go across to Dr. Sangeeta Reddy, Joint Managing Director of the Apollo Hospital Group. Dr. Reddy, good to speak to you. It is an important day today, 45-plus citizens allowed to get their jab. What sort of reception have we seen at the Apollo Group of hospitals? I think your audio is muted, Sangeeta. Can you just unmute it for us, if you can?
Yeah, okay, Vishnu.
Go ahead.
Yeah, so completely agree with you. It is a good day for the country because the base of people who are now eligible to get vaccines is expanded. Across all the Apollo hospitals, we have about 57 centers which have been approved, and all of them have seen a significant expansion in numbers. So I think we're doing approximately 70% more than we did yesterday.
Wow.
So it was,
By numbers, what would that mean?
Very good response. So I think we're upward of about 18,000 across the country. And so it's really been a good response.
And yesterday was approximately how much in the last few days?
So yesterday we saw under 10,000.
Right. So you've almost doubled it.
Yeah. So it's been a very good day. A lot of pent-up demand also, but I hope this continues. We're continuing our efforts in really educating people about the importance of coming forward, and also at the same time repeating to everyone the importance of retaining COVID-appropriate behavior like masks, because one jab does not protect you. You need to have the second dose and then wait at least 2 weeks
14
after
days.
the second dose before you're fully protected. And even then, I would urge people to continue to wear their masks. So that's become a big messaging and a communication plan for us as we continue to ramp up. We have almost 40 more centers that we're opening. We've written to each of the state governments saying we're happy to add to the numbers, because the country actually has about 21 million people now who will become eligible in this age group or this category. Actually 21 crore people. 200 million people are approximately in the age group of 45 to 59.
Right.
So this is a significant number, and if we can really get this number of people vaccinated as soon as possible, it'll be one step closer to a safer, environment in India.
All right. Dr. Naresh Trehan, Chairman and Managing Director of Medanta, the Medicity, joins us as well. Dr. Trehan, same question. What sort of response on day one of 45-year-old citizens and those above 45 getting their jab?
So there has been a huge response to that. I think there is people who were very anxious all these days that when is their turn going to come? They all turned up. I mean, and also the point is that we have extended hours. It's 24/7. So the crowds are still going on. So that is it's a very good response today, but we need to know whether it will continue. I think it will, because we are surrounded. So that's another thing that we have done, is that we have tied up with the RWAs and with the industry. So we will start vaccinating tomorrow in their own workplace, so that wherever there is a good medical room, which is according to the protocol, that there are 4 things you need. You need trained vaccinators, you need a 3-room clinic where you can, one, have the registration, the other where you give the jabs, and the third where you put the observation, and also enough facilities that if somebody has a reaction, that you can actually take care of them right there, and also have an arrangement if they need to go to the hospital, that it can be evacuated right away. So all these things having been defined already, I think the drive will get momentum starting right now, and we shall be seeing thousands and thousands of people being vaccinated in the days and weeks to come. So I think it's a good thing vaccine is available, and they also, like the mandate that, look, wastage has to be stopped, and even if you have not registered, then you can come around 5 to 6 o'clock, and people, whatever spare vaccine is available, if you're eligible, will be given to you. So there is a lot of leeway here, and I am hoping that many, many people will get vaccinated and feel the security in coming weeks.
Dr. Reddy, would you also be doing that if you aren't already, going to workplaces or going to areas where you can reach out to citizens who can't come to you?
So absolutely, Vishnu. We have done this in large numbers in terms of pre-registering people. We are in the process of getting government permission to do that, of course, following the appropriate criteria and protocols to do so. It is also one of the plans that we have, and we're working with the different governments to take large infrastructure spaces and set up. So whether it's, large convention centers, so you can do this at scale and really make it very convenient for people as well. So multiple methods. We have to open up every possible channel so that we can vaccinate, mass vaccinations at speed and scale is really the name of the game to help us control this and ensure that we don't get into, the situation we were about 5-6 months ago.
Yeah. Dr. Trehan, last time I was interviewing you, you had voiced some concerns on the availability of the vaccine. Is the vaccine now coming in at the rate that you need, given the increased numbers?
Yes, it is available. 6 crore doses are available from Serum Institute. That's the AstraZeneca. And there is 1 crore available right now from the co-vaccine manufacturers, Bharat Biotech. Now, the other thing that's coming on that we are expecting, that the Sputnik vaccine will get clearance in the next coming days. So if that happens, they will also add, and they've said that they could give us about 3 million doses in the beginning. So then this will all add up to the fact that the pent-up demand that we will get from these 45-year-olds and above So now we know that there is a huge number, and we have to reach the 30 crore mark, which we estimate.
This is all welcome news. You know, we've been talking about the worst aspects of COVID for so long. It's just so great to hear that people are lining up for their shot. I'm getting my shot tomorrow, by the way, Dr. Trehan. You'll be relieved to know.
Very good.
After talking about it for 1 year. Dr. Pandit, you know, any thoughts that you can actually tell our viewers, you know, about the importance of waiting for half an hour after their injection so that you can keep an eye on them, because that's part of the process. You don't just take your injection and go home.
Vishnu, if I may just digress one bit and tell that our nation should not have any vaccine hesitancy. In fact, we should be obsessed with vaccine to the point that we should be called as a possessed nation of people who are actually want to get vaccinated. So that's my first message to all the viewers, that do not have any hesitancy, be obsessed. Make sure that you get your vaccine. Coming to your question, basically that 30 minutes time is to make sure that there is no untoward side effect of a vaccine. Now, the good news is that throughout the country, millions of people have got vaccinated and we've not had any of such reaction. However, that safety margin has to be kept because it's an injectable vaccine, unlike the oral polio drop, which can actually be given at home as well. And this safety is for making sure that nobody has an anaphylaxis reaction, nobody has any lightheadedness, giddiness, and that facility is there in every vaccination center to take care of such a complication if it was to arise. But as I said, the silver lining is that we've actually not seen any of the major complications, and touch wood for that. And I feel we'll be actually having a very, very successful vaccination program going forward.
Okay, that's excellent news, and hopefully this continues. I'd like to thank you all very much for joining us. There were lots of people who were out today, well-known people. There were ministers, political leaders, authors. I spoke to Jyotiraditya Scindia and Chetan Bhagat earlier in the day. Thanks very much for being with us. Are you relieved that you've actually got the jab today? It's been a wait. Are you relieved that you finally got it?
Yes, absolutely, Vishnu. But I think that it's an extremely well-articulated process. And I think I must congratulate Prime Minister Modi and our government in terms of ramping up the vaccination process from its nascent stages in mid of Jan. And the fact that we've been able to vaccinate almost 50 million people with both the jabs, the first shot as well as booster second dose, and are on track to vaccinate almost about 300 million additional people by mid-June, in itself talks about the scale of the vaccination process in India, which is probably one of the largest in the world.
Let's talk a little bit about COVID in Madhya Pradesh, because the numbers, and it reflects what we are seeing across the country, are quite worrying. On the 1st of April, 2,332 new cases, the 7-day average 2,175. Now, I don't know if this is true in Madhya Pradesh, that it's primarily young people in the age group of 18 to 30 or getting it. Certainly in Delhi and Mumbai, that seems to be the case. But there is a concern that this strain now is affecting younger people. Again, is it time for people to look at COVID more holistically, not believe that, look, I'm young, I'm not going to get it?
Well, I think, first of all, the Madhya Pradesh government is putting its best foot forward, and we are still below our high of last year in terms of number of cases. But having said that, it's important not to let down your guard. Not to let down your guard, whether you're government or whether you're a private citizen. I think the very fact that within our country, a lot of us have stopped wearing masks, have stopped practicing social distancing, have stopped practicing using sanitizers. And a lot of it is also coming from fatigue of doing this for the past 1 year. But I think, in fact, the logic operates the other way, that if you've been lucky enough or safe enough not to have exposed yourself to this dreadful disease for the last 12 months, please don't do so when you're on the last leg prior to getting your vaccine.
Well, one of those who was vaccinated today, Chetan Bhagat, the author, he joins me now. Chetan, were you looking forward to getting your vaccine? As many of us have been. I'm getting mine tomorrow, but were you looking forward to today?
Yeah. Thanks for having me. And, I must say I went to it like a movie. I mean, we can't go to the movies much these days, but today, 1st April was the day I was eligible. I'm actually 46, so just made the cutoff. And I went first day, first show.
Excellent. That's superb. And what is your message to people watching? Because there are those who say that, it's not going to get to me. Oh, I'm very young. Nothing's going to. So what is your message to people like that?
So I have 2 or 3 messages. One is this vaccine is the only way out of this corona. As we have seen, lockdowns or shutdowns and all kind of things, they work to a point. But to really get, we've seen a lot of second waves, third waves coming. And I think vaccine works. We have data from Israel, you can Google it, which has vaccinated everybody. And they went from 9,000 cases now, 7-day average, to now around 400, 500. So that's a huge reduction. We are seeing the UAE seeing the same kind of trends. The deaths have an even better trend in a way, like that the serious illness becomes less. So they have been proven now, not just in a lab test setting or a field trial, but at a country level. They work. They have billions of dollars have been spent to make these. The best minds in the world, the best regulators in the world have approved it. And I think to kind of believe these WhatsApp forwards that keep coming, that, this will happen, that will happen, and aliens will be born in your house if you do this. All that nonsense is not very productive. The second message is that it's not a one-day process. It's a almost 2 to 3 month process of developing this corona immunity. Dose 1, then depending on which vaccine you get, 4 to 8 weeks for dose 2, and then another 2 to 4 weeks to get that immunity. So 3 months it will take. I've got the vaccine today, but I am not immune to corona right now. But I've started the process. And there may well be some immunity, and there are tests that even the single dose helps. But, at least I started the process now so that by April, May, June, by the end of June, I'm immune. So get it and get it as soon as possible. And I know a lot of young people are not yet eligible, but you have someone in your family who is. So take them. When you were kids, usually parents take their kids to vaccines. Today we live in times where parents take their kids take their parents for vaccination.
Well, on now to another big story. Last night, a late evening move, quite unexpected by the Finance Ministry. A decision to fairly drastically cut the interest rate for key saving schemes. The move would have been disastrous for millions who depend on those schemes as a source of income. By the evening, however, a massive U-turn. The government said it was an oversight and they withdrew the order, did the Finance Minister. Joining us now to discuss this, Supriya Shrinate, National Spokesperson of the Congress, and Sunil Alag, who's an independent business consultant, also joins us. Supriya, let me come to you. The BJP would argue that, look, we were receptive to what people have actually said, and therefore we withdrew it. It has nothing to do with elections. How would you respond to that?
I would laugh off at that suggestion, and a very blasphemous suggestion that they would make. The reality is that if this was to go through, savings rate would have gone down to a 46-year low. And who are the people who put their money in national savings schemes? Not people who are very well heeled and can put money in stock markets, which see big, crests and troughs. It is people in the middle class, in lower middle class, pensioners, who really put their money in small savings schemes. And for them to be actually told that your money is now going to go down the drain because they are dependent on that money would have been a very, very, if I may say, a very, a very insensitive move. The reality is that 15% of all the funds that come into the National Savings Scheme portfolio come from one state, and that's West Bengal alone. These are just electoral reasons why this thing has been rolled back. This has been done on hindsight. If the government...
All right, 1 second, Supriya. It's been done on hindsight. Let me just bring in Sunil Alag on that. Sunil, Priyanka Gandhi Vadra says, really, Nirmala Sitharaman, oversight in issuing the order to decrease interest rates on GOI schemes, or election-driven hindsight in withdrawing it? Respond.
Look, I'm not interested in the process as much as everybody else is for criticizing the government. Look, I am looking at the net result. The net result is, I don't know whether Sitharaman knew or not, whether the Prime Minister knew or not, who's corrected her.
The Finance Minister wouldn't know of a step like this?
No, 1 second. He may not, I'm not even getting into it. All I'm saying is the net effect is very good. Look, you can carry on discussing, okay, let's assume they made a mistake, so what? They've corrected it, you should compliment them on their correction, rather than saying, no, why did you say it first? Now you're saying it second. You're saying it third on that same day. It's not that they've corrected it after 1 week or 2 weeks or a month. They've corrected it immediately. We are interested, the people are interested in the net result. The net result is positive. I would say thank you to the government. I wouldn't get into why, what, who made the mistake, who didn't make the mistake.
But Mr.
Okay,
Alag,
they did it in the morning and they've corrected it
right,
for everyone.
but the decision itself would be fairly disastrous for lakhs. And I think the question is, okay, fine, for this quarter we are all right. What happens after the elections are over? I mean, a cut on the interest on small savings from PPF to 6.4, NSC to 5.9, senior citizens to 6.5, it would, a lot of people would say, annihilate the middle class. I mean, this is what, how would you respond to that?
Look, as far as I'm concerned, the exact figure, look, the government, 1 second, Vishnu, the government is doing a lot. They've not raised taxes. They've not done a number of things. They're reducing the price of petrol. All the states are getting involved. Where's the money going to come from? So even if they reduce something for 1 year, it doesn't mean it's cast in stone. They are going to increase it again next year. As far as I'm concerned, look, the money has to come into the government somewhere. And if they've corrected themselves, they've corrected themselves. It should be complemented.
All
why
right,
are we getting into why?
Supriya, is there a concern that it's just a matter of time before this is introduced?
You know, I don't share Sunil's benevolence. I don't share Sunil's optimism simply because this government has let petrol prices cross 100. It has let, gas cylinders cross almost 900 for some parts of the country. And it has sat there as a mute spectator.
Petrol prices are driven by the economy, right? Subsidies were withdrawn years and years ago.
No, I'm sorry, it is not. The subsidies were withdrawn.
There are state taxes, which is the concern, right?
No, Vishnu, I'm sorry. I share some amount of economic knowledge here on the show.
You do, absolutely.
Let that out. The reality is that central government's kitty has swollen multiple times, and the portion that is shared with the states, which is special and additional excise, has been consistently reduced. Only basic excise is shared with the states. The rest of it is not. That has gone up consistently. The largest chunk of the petrol pool, diesel pool, has gone to the central government. No, sir, I'm sorry, you may nod in negligence, but the reality is...
Okay, Supriya, fair point, but let's get back to the topic at hand. And my question is it just a matter of time before this does happen?
Which is what the fear is, which is what people fear. Just because of elections, this has been put on hold, but God forbid, once elections are over, this is going to go all out in Gango. Because the psyche of the government is to benefit the rich. The psyche of the government is to give a 1.5 lakh crore bonanza to the rich by cutting taxes, but reducing the saving rate for India's vulnerable, for India's elderly, for India's poor, for India's middle class. Who are the people who can spend in this? People who can only minimum park tokens of 1,000 rupees. And is anybody going to deny them that? That is what this government is doing. It tells you of the government's psyche. It tells you of their mindset. They really are anti-poor, anti-people.
All right, Sunil, is this an anti-poor, anti-people government? Why target the some of the most vulnerable segments? Every last hard-earned rupee is there for a purpose. People earn an income of it. Sunil, go ahead.
Look, all I'm saying is we can all live in fear. The government is going to do this. The government may not do it. Look, when it happens, I'll be the first one to criticize the government. Right now, we got to praise them. Instead of living in fear and saying, oh, after the election, this might happen. What if it doesn't happen? Let's discuss it when it happens rather than when it might happen. That's all I'm saying. I'm not in favor. I'm not against it right now. They've done a very good job. They've corrected themselves and we should compliment them.
All right. I think the question which will remain unanswered in all of this is how was this decision taken and how was it actually withdrawn? What were the circumstances of that happening? I'd like to thank you both very much for joining us. Completely out of time. Need to take this short break.